Good afternoon. Thank you for tuning in to our 12th year anniversary celebration of the Affordable Care Act. My name is David. I'm here as a part of 4 Hour Future Florida, joined with some really incredible panelists here to discuss the impact that the Affordable Care Act has had over the past 12 years since it got passed. So we are joined here by our state senator for Florida, Janet Cruz, as well as Alison Yeager with the Florida Health Justice Project. And then, of course, Maggie here as a part of FOF as well, and Juan in South Florida. So I'd love to hand it off to our panelists to get to introduce themselves and tell us a little bit more about what they're doing in the state. And want to start with Senator Janet Cruz. Thanks for joining.
Hello, everyone. It's a pleasure to be part of this panel. I'm here with some pretty damn distinguished guests, so I'll do my best to keep up with all of them. But just got finished with 60 days of a grueling session where we, did some blocking and tackling, trying to maintain the rights of and the dignity of Floridians. And it was much to our disappointment that we have many folks in the legislature that are just trying to get themselves out of a primary rather than do what's best for Floridians. So I want you to know that we continue to fight for women's rights. We continue to fight for the dignity of the LGBTQ community. We continue to try to make Florida a better place for everyone, not just the chosen few corporations that seem to reap the benefits of our tax dollars. Biggest budget ever in the state of Florida with, I think it was $107 billion. Our only constitutional obligation is to pass a balanced budget. There was a lot of money this year in the budget, and there were lots of projects that were funded. Although we still fell short in healthcare, we still have people on the waiting list, those that are disabled or need seniors who need more care are still waiting. It used to be worse, and I think sometimes what our state thinks is that we should be thankful for whatever anyone gets, but we still have thousands of people. We had a waiting list of 10,000 at one time, so we have much work to do. I'm thrilled about the anniversary of the Affordable Health Care Act. I never thought in a million years that we would have to fight for people to have the right to health care. It's not a privilege, it's a right, but think that it's a privilege to have health care in this country. And so we continue to fight for those working families that don't have coverage for so many reasons or can't afford to even access the program that they have because their damn deductible is so high that they really, my son was saying to me the other day, he is a small business owner. He was paying almost $900 a month for a plan. And every time he goes to the doctor, he called me, he's like, give me a different plan. I'm sick and tired of everyone saying they don't take my plan. And it wasn't because he didn't have a good plan. It was a $900 a month plan for one person, but it's because it's a marketplace plan. And if they think there's not discrimination going on, there is. So we have much work to do, even though we've come a long way. So I want you to know that I'm here to help, and we need to celebrate the fact that this is already 12 years old. It seems like yesterday that this started. So I'll be quiet and give the floor to someone else, but thank you.
Awesome. Well, really glad you're here, and so really looking forward to the perspective, especially around healthcare. And here, of course, to provide a great perspective on healthcare is Alison with Florida Health Justice Project.
Thanks, David, and thank you all so much for having me today. And I am honored to be here with Senator Cruz and with Maggie and you and David, you and Juan. So Florida Health Justice Project is a statewide advocacy organization, and our mission is increasing access to health care for Florida's most vulnerable and marginalized residents, which really means every Floridian should have access to health care, should have access to affordable coverage, comprehensive coverage, when they need it, where they need it. And we know there are too many barriers still to healthcare for too many Floridians. The ACA was an incredible step forward. Unfortunately, Florida has opted not to take up one key component of the ACA, which is the Medicaid expansion piece. And I'm sure we'll get back into that in a little bit, but that's a big piece of our work at Florida Health Justice Project, is trying to get Florida out of the group of 12 states that have refused to expand Medicaid and to join the other 38 in DC that have seen the wisdom of expanding Medicaid so that so many more of our state residents can have access to coverage. But thrilled to be here with you all and excited for this conversation.
Awesome. Yeah. And our next panelist is a part of the South Florida team. I know Maggie is here. Yeah, would you like to introduce yourself?
Hello, hi, good afternoon, everyone. Senator Cruz, how you doing? Juan, everybody, thank you for the invite, everybody. Juan. So my name is Maggie, and I'm a mother of two, and I'm the kind of the third eye for our future out there. And every day we do the street by street, the avenue by avenue, just to know what the people dealing with out there on the street. So by having us, like I said, we are the third eye, and we need to know whatever the people wants to have in the Affordable Care Act, especially with the COVID-19. We are there. We're taking the notes day by day, and we do the input, and we want to make sure that we have as much as input for people like you, Senator, and Juan, and the rest of the crew to see how we can, stop the crisis, and even going further with the Affordable Care Act to see how we can resolve certain things. So I'm glad, I'm very happy to be here. This is my second time being on a panel like that. I'm very excited. And what else should I say? I cannot wait to tell you guys about my story. Thank you for having me again.
Really looking forward to it. And then, of course, my good colleague Juan in South Florida, doing being the regional in Miami and onward. Yeah, how are you this morning?
I am great, David. Thanks for asking. And I'm honored to be here with all of you. My name is Juan Moore, for those of you who don't know or are joining us for the first time. I am the regional director, the South Florida regional director for Our Future Florida. So that's Miami-Dade County, Broward County, and Palm Beach County. With so much going on and us coming out of what I thought was a really rough legislative session here in Florida, it's great to be celebrating the Affordable Care Act, and it's good to look at what good government looks like when it's thinking about the people. So I'm honored to be here. Let's talk.
Indeed. Yeah, so of course, a big part of this panel is, of course, to talk about this is 12 years. Happy birthday to Obamacare. And it really didn't have to be like this. Really, if conservatives had their way, this legislation that has made a difference already in so many lives would have been repealed 100 times over, either in Congress or under President Trump. And if it were up to them, it would be back to the days when people were disqualified based on pre-existing conditions, when children were thrown off healthcare at 21, and when affordable options were inaccessible. So I think that's one of the places we'd like to start, is taking a look at really what things were like before 2010 when this was initially passed, and recognizing the barriers that were in place before. So I'll go ahead and turn it over to Juan to talk a little bit, and then of course open it up.
Oh, can't hear him.
Sorry, Senator and Alison, you're probably used to me doing that. Story of my life. I still got to get it. I made it. I remember one time I went like 5 minutes and then David told me I was on mute. So thank you, David, for the early flag there. But what was healthcare like pre-Affordable Care Act? So insurance companies could deny you for coverage if you had pre-existing conditions, which is horrible. 12 years ago, insurers could and would cancel your coverage if you got sick or injured, which we know that happens a lot. Things happen at the workplace. Women seeking individual coverage were often denied maternity care and had to pay more for coverage than men. And young people had more limited options for coverage and often went without. I know I was one of those young people. So let's open it up for a discussion. Do you, Alison, or Senator, can you remember or tell us more about pre-existing Affordable Care Act before Obamacare?
I'll tell you one that I remember it well. I had a woman that was my hairdresser for, 15 years, and she was someone who came from Colombia. She was a U.S. citizen, and she lived in a small apartment in a good school district because she wanted to ensure that her daughter went to a great school, made lots of sacrifices for her, asked no one for anything. She worked so hard. But she was a diabetic. And because she was a diabetic, they refused care to her. That's what was happening. I mean, she couldn't get health care coverage. I called friends of mine who owned an insurance agency, and I said, Shadi, I have a woman here who works hard. She has the money to pay her premium. She's like, nope, no way. Pre-existing condition, I'll never find a place that will give her coverage. And she was willing to pay whatever they said. She just needed coverage. In the end, she ended up with a lymphoma, and I had to go to Moffitt and ask them for an indigent care plan for her because she was uninsurable, and it was really very sad. The good news is she's doing well today, and she has Obamacare today. And I just want to add something to what you said earlier, Juan, and that is that because we didn't, and I remember when we were in the legislature, we refused to vote for the budget because we didn't pull down the dollars, and we made a big deal about it year after year. But I think one thing that Floridians don't realize is that in not drawing down those federal dollars, we became a donor state for other states. Our tax dollars that have been collected on a federal basis went to other states to pay for their health care. And in not doing that, being short on the money and the dollars in Florida meant, in my opinion, that it was a double taxation to Floridians. And let me explain to you quickly what that means. That means that we didn't take the money, but we still have the health care needs. We still have uninsured folks showing up in the emergency rooms. We still have people sicker than ever because they don't have access to care. And who pays that? Most of us pay that because it gets spread out among premiums for both major companies and small business owners. We all pay for that. So we're paying for it with our federal dollars that go to another state. And then we're paying higher premiums on healthcare because our state doesn't have any subsidy. And to me, that is just a crying shame that, again, they made healthcare for Floridians political. It's ridiculous. We estimate that at least 6,000 people a year are dying because they don't have access to care. And remember that there are folks in the Medicaid program, mostly children are in Medicaid, but those and the disabled and the seniors in nursing homes, they're on Medicaid. And then people like me work for the state, and I have pretty good insurance. I really do. But it's those folks in the middle. It's the working poor in the middle that make too much money to qualify for Medicaid, don't have a decent program that's offered to them. I talked to a woman that worked at AMSCOT. She has her children on one of the state programs, but for her alone, it would be $300 a month for her insurance coverage. Well, $300 a month was the difference between groceries or gas or something for her family. So what did she do? She opts out of it because she simply cannot afford a $300 payment. So we have to do better. We just have to do better. We owe Floridians and families, working class, hard working families. We owe them more than what we're doing now. I think that I've said enough.
Absolutely, you could keep going because you hit you're spot on. So I thank you so much for that input, and I agree.
And I think I could echo everything the senator said. And, just a little bit about what I remember pre-ACA. I used to work at an HIV organization serving folks with HIV, and so many folks were unable to get coverage because of pre-existing conditions. And I also remember, I was at the age where some of my friends were starting to have kids pre-ACA, and I remember people having to pay more for maternity coverage within their insurance policies, and how we all thought that, how could that possibly make any sense? So there were so many unjust and, just sort of irrational components to the healthcare atmosphere pre-ACA, and the ACA just looked at the full spectrum of challenges that people were facing and really attacked them from so many different angles. The ability to access care, the ability to afford care, the ability to stay on coverage. The ACA really tried to approach all of the ways in which the system was failing from so many different angles. And as the senator was talking about, the chief injustice that remains in Florida is that now our own state legislators, or sadly, the majority of them, we have champions, and one of them is right here with us, but the majority have chosen not to take up this option to expand Medicaid. The original Affordable Care Act was designed so that all states had to expand Medicaid. And then some states sued the federal government saying, no, we don't want to do that. You can't force us to do that. And the Supreme Court agreed with them. So then it was tossed back to the states as a state option. And now Florida, like I said before, Florida is one of just 12 states that have continued to drag our feet. And it's estimated that there are 400,000 people in this Medicaid coverage gap that the senator was referring to, and that well more than 400,000 would benefit if we expanded Medicaid, probably double that number, folks who have subsidies that are higher than they really can afford, or copays that are higher that they can afford, and would newly be eligible for Medicaid. And could move from the marketplace to Medicaid. So, it's estimated between 800,000 and 1 million people could benefit if we took up that one last piece of the ACA that we've dragged our feet on. But yes, the ACA, all the pieces that we have taken up in Florida, not by any choice of our own, but because they were federal mandates, have made a huge difference in the landscape for folks. Though there is still work to be done. And one thing we've seen during these COVID years is with enhanced subsidies, what a difference that's made. And the senator also referred to how high the costs of copays are, and how we really do need subsidies that are more affordable so that the plans really are working for everyone in the way that they were originally designed to. And I'll stop there.
Yeah, thank you so much, Alison. And I agree with you as well. I think looking at it from my standpoint, because 12 years ago for me, but one thing I do know living here in Miami is that it was extremely harder for immigrants or people who weren't naturalized here. And so that was one thing that I could definitely say I could remember pre-existing Affordable Care Act, that, even some of my friends' parents were just out of luck. They could not even qualify to get it, and definitely couldn't afford to get health care. So that's one thing I could add in.
And
David,
what?
Go ahead, Matt. I'm sorry.
The minority office in the Senate, we do lunch and learns, and I forget the group that came in, but they talked about this cliff, and it was really very interesting. But it talked about, like, say, a single mom who's getting some help for childcare and going to school and getting help for going to school. But if she works, you know, XYZ, or, you know, she's in a nursing program, but they were talking about how if she makes not enough money to live on, but makes this much money, then she would fall off the cliff and lose all of those benefits that are helping her to succeed. And that's basically what's happening here. With our programs. You know, we have these programs, but a $2,500 deductible might as well be $1 million deductible for some people, you know. So that's part of the reason that I say we could do better. But, you know, this year we saw a major increase in the open enrollment across the country. Not sure if that's a function of COVID and the fact that people are not making as much money or not employed, but you know, the Centers for Medicare and Medicaid Services show that Florida experienced almost 28% growth in enrollment, and we have a record of 2.8 million Floridians in total. That's pretty amazing. I mean, that's really incredible. Even though we continue, and Maggie, I want to hear more about what you do out in the community and how you reach out to people. I'm very intrigued by what you talked about earlier.
Basically, I've been doing that for almost, let's say, 12 years. From, you name it, like SEIU, whatever, non-profit organization. I usually do door to door. So we will go and, ask them about some personal question. If they're already, vaccinated and the booster. If not, if they kind of in a limbo, they don't want to do it. Sometime I will take my time and see it and call CVS or Walgreens or whatever to help them to get an appointment. So I will, we still have to keep yourself away from me. I will keep myself away from you with masks and everything. We're protecting ourselves, but I make sure, like, throughout the day, if I will take 30 or 45 minutes, I don't care about goals, but I'm going to help someone to get themselves in a safe place. Get your booster, do the first thing, especially our young generation, the one who doesn't believe in the vaccination. So I always take time. And sometimes I'll call Juan. I say, Juan, I just meet an abuela. Abuela need help. Abuela don't have kids here. They're long gone. So how could I help them, Juan? And kudos to you, Juan. Juan always say, Maggie, text me the name and the phone number. I will do my best to see how can I help them. So sometime, I will encounter that throughout my day. So I always find a way to, to help them. And I mean, we have goals every week. Sometimes I don't care about goals. As long as I help 6, 7 people per day, that made my day. I will come home with my kids. I'm happy. I'm good. I'm ready for the next day. This is something that I like to do. I love it. It is in my blog. I'm Haitian, by the way. So I'm very passionate in helping not my community, people in general. So I always take time to help people. And I love doing that. What else should I say? You were talking about a nursing mother going to school and she couldn't get help for childcare for kids. I was a victim of that. I have to choose from go to work full time or don't go to school or work part time for my 4-year-old could go to school. I choose to keep it at home and I do the little ABCs with him. I get myself a blackboard. I help them. And then I say, you know what? When mommy is, getting there with the money thing so I can pay something private for you, you will go. But unfortunately, you couldn't go because it was COVID. Then mommy had to save more money and get ready after the COVID for baby to go to school. He's in school now, and I'm happy that you talk about that because that's, as a foreigner, we suffer a lot about that. I mean, to choose whether you go to school or work full time or school full time, especially if you have a kid and then your husband is somewhere far in Haiti and then he's not here yet, it's all on me. It's all on you. So should I share my story now?
Yeah.
Okay. So I have a great story. It's me being here, always have a good job, helping job and always get money to help other people, always find a way to help people. And I applied for my husband. My husband came last year, the January the 21st. And by the time he get here, I lost my job due to COVID. They let me go. So it was another body, another person to taking care of them because it is my priority now to help them. So I know health, it's very important. You have to have your health. So no way you have to go to the hospital. And then, the climate, when you left Haiti and come here, it's totally another thing. So you need to, to get your check up and everything. So, and by the time he gets here, I knew because I used to do the Affordable Care Act somewhere in Oakland, in Broward. I know that there's an open date and then there's a closing date. And I said it was the same thing. And I was like, wow, it's a bit too late. We have to wait November 1st, to see if I can, purchase something through the marketplace for you. And then one day I was browsing to Facebook. I love Facebook. I love, listening to people reading the chart. And then one of my friends posted that there's an extension. I said, oh, well, if there's an extension, let me purchase for you. I was so happy to purchase his first little insurance for him, even though I couldn't get a Gold Plus thing for him, but at least I purchased something. And short story, my husband ended up, he took me to the hospital, and then they ended up keeping him because his sugar went up to 500. So lucky for me and him, we already purchased some insurance to the marketplace. And then I don't know, 12 years. And and I applaud President Obama for doing that to us. If I wasn't for that, I don't know what would I be doing right now with my husband. He is 6'6", big tall guy. With and what would I do now if marketplace didn't exist? What would I be doing there? Should I send him back to Haiti to go, to go see doctor? It would be more money, more stuff to do. So my story is a little bit. I'm not gonna keep it there for me and use only. I have to keep telling people Affordable Act was the best thing ever President Obama ever done for us. The foreigners. I'm very happy. I'm very passionate about it. And I don't want to go further. I don't want to talk too much about it because I'm getting emotional and sweaty a little bit. And America did so much for me. America helped me in so many ways. And I didn't know it back then until my husband came here. So I'm very happy and honored to be a part of this platform celebrating the 12 years anniversary. It's an honor for me to be with you guys. I really appreciate that.
And you know what the saddest part about that is, for the past 12 years, the Affordable Health Care Act has been under a near constant attack by Republicans, both in Florida and across. Our own state attorney general was one of the #1 conservatives who signed the lawsuit to appeal the Affordable Health Care Act. I just don't believe sometimes that our state cares about people. They care about corporations and they care about people that are wealthy, but they sure don't care about the working poor. And that's my fight to take up. It's really sad.
Very sad.
Yeah, I agree. I definitely agree. We get a lot of things lately that we don't seem to ask for, right? And don't get what we need. She seems to be a trend with a lot of our leadership. We can go to the next slide, David. And Maggie, I thank you so much. Maggie, by the way, is one of our outreach organizers for our vaccine hesitancy programs, and does an excellent job, reaching out and touching the community. So I want to thank you, Maggie. You did a great job, by the way.
Thank you.
Heavily inspired.
For you.
Go to the next slide, David.
Thank you, Senator.
Awesome. Yeah, well, I wanted to highlight for folks, and especially because this, it certainly seems like a long time ago, and I guess it kind of is, that it was signed, the Patient Protection and Affordable Care Act was signed by President Obama in his first term in March 23rd, today, 2010, so 12 years ago. And it did great efforts to address the many aspects of providing affordable, comprehensive coverage And of course, making sure that people with pre-existing conditions, as was discussed many times already, that didn't continue to be the case, and is, very thankfully no longer the case. So of course, big impacts across the board. Thanks to the Affordable Care Act, we can say that 9.2 million young people have gained coverage, that the uninsured rate was cut in half, right, from 29% to 14%, and 30 plus million young adults with pre-existing conditions cannot be denied coverage, and over 62 million women gained access to birth control without a copay. So this is just a small list of the things, but there's so much more to celebrate, and of course to recognize. And so these are just a few of the accomplishments, but certainly would be happy to open it up for things that are also worth listing.
Can I just make a comment, David? It strikes me seeing this the uninsurance rate statistic cut in half from 29 to 14%. That is so amazing. And it just strikes me, I was thinking about how we've been hearing recently with the COVID relief packages that have come down from Congress, how the direct payments to families has gone so far in addressing child poverty. And that what we see with these kinds of programs from government is when government makes an effort to directly impact families' lives and to improve conditions for people by ensuring that health coverage is affordable and ensuring that people have the money to buy food and pay rent and pay for their kids' uniforms and school books, that those programs work. And we can cut uninsurance rates. We can cut child poverty rates. When government comes together and says we're committed to making a difference, it does do the thing they set out to do. So I think it's so important to remember that when our elected officials are committed to changing an outcome, they have the power to do so. And we see it right here.
Yeah. Well, one of the biggest things, and I know a lot of people have already gotten to share a little bit about it, is of course the big question as we look back on 12 years is, how has Obamacare impacted you? And I know that for lots of people, and even myself being an example, just the simple process of having a job, losing a job, do I lose coverage as a result? And for lots of people, that gap gets filled by Medicaid when you're living in a state where that expansion is made, and that's just such an important buffer that ultimately people need their jobs to live, gain an income, but of course when it's extra in the sense that it's tied to how you even get your medicine, that makes it especially difficult. And knowing that just bridges a gap is such an important step that was made, and that maybe people think about, maybe they don't, but ultimately that's a safety net that's there, and one that really glad to see. But really excited to hear, of course, what other benefits people have seen happen from implementation.
Maggie, do you want to speak some more?
Well, what else should I add? Should I say that Obamacare is a home diggity for me?
I'm curious in the work that you're doing in the communities, if you've heard stories from people about their experiences with Obamacare.
I do. I remember one of the ladies that I went to her house, and she didn't remember to tell me she purchased her insurance from the marketplace. She told me she went to an agency and they told her that she need to have some type of insurance to get the vaccine. I said, no, they're not supposed to charge you for a test or for the vaccine. All you have to do is free. And I was very happy that I was there that day to help her to do that, because when I asked her that, what did she purchase her insurance, she said she went to an office, and then she couldn't tell me the difference between if she purchased it from the through a marketplace. She didn't know the terms, but when I look at it, she had the same insurance as my husband, and I said, "Oh, she purchased that through the Affordable Care Act." And I have to, educate her on that. I have to tell her, this is the Obamacare, and this is not uh, from your job or from a small business on a little thing. Small business, they're supposed to purchase insurance for you. I said, no, this is straight. And then she said, oh, my daughter saw them online, and she called it, told them to come in. I said, yeah, this is the Obamacare. You have it. And then you don't need to go to Walgreens and show them proof of insurance for you to get tested or to get the vaccine. So I, I was lucky to be there at the time to to tell her more about it. And I'm a talker. I I spent 30 minutes of my time, Sean, one to do that. And I took my time and I told her, hey, spread the news, tell people they don't need no insurance to get tested. They don't need no insurance to get that. But if you have it through a marketplace, it's good. She didn't know the terms, so I was glad that day to educate her on that. But otherwise, I always encounter people say that, oh, I don't want to charge my insurance to to get the vaccine, and my daughter said that I have to pay for it. Some kids, they don't want their parents to get vaccinated. They will use that. This insurance I purchased this insurance for you. I don't want you to use it to charge your vaccine on it. So I would tell them, no, it's not you. It's not I'm telling your daughter is lying to you, but it's not you. The vaccine, everything. I mean, the test is free. They're not gonna charge your insurance. They're not. And when you're talking to your elderly, you're not supposed to tell them, "Oh no, you're lying," but your daughter lied to you. But deep down, I knew that the kids were lying to them. So I encountered that, like, I mean, every day they would say, "No, I don't want to take it." Yeah, because my neighbor said that, and I heard some other coworkers who would tell me that uh, he was one of my coworkers who was telling us a story the other day, and he was telling us how uh, her parents supposed ask another her sister to go get her daughter vaccinated, and then she told her it's only one place. It was at the children's hospital. So probably she won't want the other sister to get her kids vaccinated. So there's so many things out there trying to keep people away from buying the insurance, or to have if you don't have the insurance, you cannot go to Walgreens or CVS or Walmart or your personal doctor to get the shot. So every day it's new story coming up. So all we have to do is Google research, and we have Wang, and all of us are always Googling research, and we always sharing our information among us to see how we can help our people out there. So they need our help. Yeah.
For our page.
Yeah.
In and off mute.
Sorry, I was just going to add, I think Floridians are so excited about Obamacare and the marketplace, and we've seen year after year that Florida leads the pack in terms of marketplace enrollments. And so we know that there are so many people in Florida who they must be getting your message, Maggie, because we are always number one in enrollments across the country when there is open enrollment for the marketplace. So we know that Floridians need health insurance, and we know that it's working to reach Floridians.
Yeah. I know a lot of people, they will not miss the open enrollment. They know that it's November 1st. They know. And I heard it in so many Haitian radio stations. Either they're getting paid to do that, but they're doing a good job. Like talking about it's open enrollment. And then you will see big sign, it's open enrollment, it's November 1st. You don't see a lot of people, but best believe it, they know it's the best way to do it, and they know too. If you don't do it, they will charge you $500 from your deductible from your tax. They already know this is the must. We must do it, and it is a great opportunity to purchase insurance from the marketplace. When we're ready, they will send us a paper. We know that there's a paper will come to your house. When you're ready to claim your income tax, you need to show it. This is your proof. And they are following up. I'm telling you, especially in my community, I live in District 4. I mean, North Miami, we know that we do that. And for fun, I used to go and talk at I will go to my church and I will stand in the parking lot talking to people. I kind of use my community. They know me. I love doing that. So we know when it's open enrollment. We know, I didn't know that after COVID, we will have an extension, like I was saying earlier. But we know open enrollment. We know when it will be closing. And we know before income tax, we're supposed to receive that letter. With that, this is your proof. And we know that this is kind of, they let you borrow money. This is great. As a Haitian, we don't even have that in Haiti, for the government to let us use some of our return money and spread it throughout the year for us to pay $70 for health insurance. Why not get in it? Why?
I love that you mentioned that, and I think
Yeah.
my Mac was dying. I was coming in and out of mute. But one thing that I wanted to say is that I remember, and my wife refreshed my memory, how hard it was for her mom to get health insurance. And I think the senator was also talking about, so she knew somebody with a pre-existing condition, but she also had diabetes and COPD. And just now she has gotten her insurance through the marketplace, and she constantly is going to now the podiatrist and getting massages and getting specialists that she never had before. So, and definitely enjoying her life now because of the availability of insurance through Obamacare. So that was, shout out to my mother-in-law. If you're watching, I didn't forget about you, but yeah.
Oh, wow.
So, yeah, well, all of this is incredibly relevant because last year, around this time as well, the American Rescue Plan passed, and that included a good bit of bolster to the Affordable Care Act, and can kind of see here that there's just a lot of things that people that are using the marketplace can look forward to, and certainly have been able to take advantage of. And I know Senator Cruz had mentioned that there was a lot more people, and Alison had just mentioned that a ton of people in Florida are using the marketplace, and it is really a big victory to see that people are enrolling in health insurance so much this year, and many times for the first time with these new subsidies that have been passed as a part of the Biden American Rescue Plan. And so every year, Florida has been leading the way in enrollment, and this is just demonstrating the need that we have here to have affordable healthcare in the state. And so this here outlines just the financial help that's available for people through the marketplace, and if anyone's at all had experiences in the marketplace before the American Rescue Plan, should definitely look at it again and see how things have changed, because a lot of times you can see here that there's financial help for people that may have thought that they made a little bit too much to get decent assistance.
And David, I'll just add that, I'm sure folks have heard lots of talk about the Build Back Better Act, which was the most recent sort of COVID package that's been debated in Congress that has not been passed yet. And now it looks like it's maybe taking on a different form, being chopped into smaller packages. But one of the pieces of Build Back Better that's really important is the extension, sort of the permanent extension of these subsidies from the American Rescue Plan. And so I think one great opportunity for folks is to let their U.S. Congress members and senators know how important these subsidies have been, these new subsidies under the American Rescue Plan, and that it's really critical that Congress extend them permanently so that the marketplace plans are even more affordable. And I'll just mention also another piece that was talked about and was included in Build Back Better was a federal fix to the Medicaid coverage gap. So for all those 12 states that have failed to expand Medicaid, the federal government was getting ready to say, we're going to allow anyone who doesn't have Medicaid expansion in their state to get a free plan through the marketplace. And It's a little different than expanding Medicaid, but it would have given coverage to all those folks in the coverage gap. It wasn't slated to last forever. It would have been time limited. But again, if Build Back Better is on the rocks right now, it's so important to let your members of Congress know we need that federal fix for the coverage gap, and we need these subsidies to be extended indefinitely.
Yeah, 100%.
100%.
Well, I know one of the, like, as we close out the space, we're of course wanting to invite people to join it as well. So, you know, folks that have their own personal stories around the Affordable Care Act. We really hope people would take some time to share it, especially on this day, 12 years after it passed. You can use the hashtag ACA12 to share your story on Twitter. And of course, we do have an active petition on how to expand on the need to expand Medicaid in Florida. And so you can see that with the forflorida.us ACA12 to make sure that our representatives, senators know that this is something that needs to happen and is an important fix at the federal level. So with all of that, of course, we're really excited to host this panel and host a discussion around the birthday of Obamacare here, now 12 years old. So really want to invite folks to stay engaged. Would like to invite Alison. How can people get connected with the Florida Health Justice Project?
Thank you. Yeah. So our website is floridahealthjustice.org. And our handle on pretty much all social media is FL Health Justice. FL like Florida Health Justice. So please definitely check us out and follow us. And can I just say one last thing, which is it's a little off topic about the ACA, but as folks may know, we have been in the midst of a nationally declared public health emergency with COVID. And one of the things that's meant is that for folks who are receiving Medicaid, Medicaid was not allowed to terminate anyone from Medicaid benefits during the public health emergency. But we think the public health emergency is probably going to be ending this summer. And so that means a whole lot of people are going to be disenrolled from Medicaid who no longer qualify. So one thing that's really important is to make sure that if you are receiving Medicaid right now, that your address and your contact information is up to date with DCF. So go into your Access account and make sure your information is all up to date, because you're going to be getting communications about this. And it's really important that they're reaching you so that you know what's happening. And there's a lot more information about that on our website too.
Florida
Thank you
Health
so much. That's
Justice.
actually it's a major piece of information there, Alison. Thank you so much.
All right, awesome. Well, really, of course, excited to share this space with y'all today. Thank you so much for joining to share your perspective. And of course, as people want to stay engaged, we really invite them to check out these pages and find an action, especially as we get the chance this year to really make our voices heard, and of course, make an impact on who we're sending to make these important decisions. So really, of course, want to say one more time to everyone watching, happy birthday to Obamacare. Thank you for tuning in, and I hope you all have a great rest of your day.
Thanks,
Later,
everyone.
ladies.
Sorry we
Bye,
lost the
everyone.
a little early, but
Bye.
thank you all so much.
Bye-bye. Have a great day.